The Gaza Strip has been polio-free for 25 years, but in July, the virus was detected in environmental samples from Khan Yunis and Deir el-Balah. Health officials describe the risk of polio spreading in the enclave as a, quote, contagion time bomb. The polio virus is highly infectious. It usually spreads through sewage and contaminated water. Symptoms can show a week after exposure to the virus. The virus, which can cause disfigurement and paralysis, can also be fatal. It mainly affects children under the age of 5. Now, Dr. Margaret Harris is spokesperson for the World Health Organization, joining us now. Doctor, thank you so much for your time. I wonder if you could first just update us on whether there are any more confirmed cases of polio in Gaza since the diagnosis of this 10-month-old.
So what we know and what you've just mentioned is 3 cases of acute flaccid paralysis were detected. This, when you're looking for polio, you look to see if any children have what you call this flaccid paralysis. Now, there are other causes of that, but in this instance, we have seen this in 3 children and have sent samples. So we're awaiting the results of those samples, and we don't know. But the fact already that it was found in the wastewater indicates that the virus is circulating in Gaza, and that's why we urgently are trying to mount this massive immunization campaign aiming to get to over 640,000 children.
And you're calling for 2 7-day periods where you can get in and do these vaccinations. Israel is saying that they are absolutely prepared to cooperate with UNICEF and the WHO. Can you comment on that? Is there broad agreement that this must happen? Is Israel fully on the same page as the WHO and UNICEF around these pauses?
Well, I can't speak for Israel, but if indeed that's been agreed, that's very good news, because we certainly need 7 days of no fighting, no conflict. We have to be able, we've got people all over the Strip we need to reach, and the best way to reach them is via the health centres and the hospitals, and many of those are inaccessible because they're so close to areas of conflict. We also need to be able to bring in clean water, scale up the water and sanitation system, because it's essential with polio that you have good levels of hygiene. Otherwise, again, it's going to spread very rapidly. So having those pauses will be a very good start. Ideally, what we all need to see, of course, is a ceasefire.
What exactly causes a virus that has not been present in a region for 25 years to re-emerge?
It's a tragedy, and it's really the conflict. The absolute destruction of the health system and the destruction of the water and sanitation system, and having people herded so closely together with no means of simply disposing of their waste, their physical human waste, no even means of washing their hands. So my colleagues talk about promoting hand washing. You can't promote hand washing if people can't get to clean water. Now, Gaza was a model. They had over 99% child immunization rate, which is as good as it gets anywhere in the world. And that's dropped drastically. We now have a year's worth of babies who've been born with minimal access to healthcare and certainly hardly any access to immunization.
All right, so if you get in and you're able to start this immunisation programme, will that absolutely sort the problem out? You did mention the need for water as well, but surely the vaccination will go a very long way to making sure this doesn't become what is being termed a contagion time bomb, which sounds terrifying.
Well, ideally, it will help stop the spread. Now, remember also, this can spread very easily to neighbouring countries across all the borders. But these babies, these children, as I said, have had so little access to the level of healthcare they need. It should just be the beginning, and not just like, OK, we've done that, fixed. We've got so much more to do to give these children a chance at a decent life.
All right. Well, thank you so much for that update. Much appreciated. That's Dr. Margaret Harris, spokesperson for the World Health Organization.
Thank you.